Hello dear friends, I am Dr. Hosseini and welcome to Medical and Health. When something dangerous happens in our body, it always shows their signs and symptoms. Most of the time, unfortunately, we don't concern about early signs and symptoms of our body and often ignore them. While sometimes, common changes can indicate a deeper underlying concern or something more malignant. For example, changes in vaginal bleeding, changes in vaginal discharge, pelvic pain or breast swelling or discoloration. In this video, I want to discuss about 4 health symptoms that women should never ignore, especially if they're persistent and chronic. Some vaginal bleeding is necessary, such as with your menstrual period. Menstrual bleeding happens approximately every 28 days and lasts between 3 to 6 days. But if you notice any changes during menstruation, for example change in the regularity of the menstrual cycle, noticeable change in the amount of blood during a menstrual cycle, you should see your doctor. But if you're bleeding but not on your menstrual period, it can be caused by several factors. Some reasons you may be bleeding could include infection, an underlying medical condition, medication, or hormonal imbalance. It's best to keep record of your symptoms and contact a healthcare provider for an exam and any necessary tests. Most women and girls have vaginal discharge. It's a fluid or mucus that keeps the vagina clean and moist and protects it from infection. It's normal to have approximately 2 to 5 ml of white or clear, thick, mucus-like, and mostly odorless vaginal discharge every day. However, the amount and consistency of the discharge varies from one woman to another. But if your discharge changes, for example in smell, color, or texture, it might be a sign of an infection. For example, if your vaginal discharge is associated with fishy smell, vaginal itching, or burning during urination, it may be a sign of bacterial vaginosis. But remember that many women with bacterial vaginosis have no signs or symptoms. Therefore, if you experience any discharge changes that accompany with any symptoms, consult your doctor, because it may be a sign of serious diseases that need immediate treatment. Checking breasts is a necessary exercise both at home and while visiting a physician. Any changes in skin color, texture, and swelling are all reasons to see a healthcare provider. During menstruation, pregnancy, menopause, hormonal changes, the breast may be swollen, lumpy, and tender. Feeling a lump or firmness in your breast or under your arm are women's health signs that could indicate cancer. Nipple discharge, another side effect that could occur from birth control pills, medicine, or infection, may also be a sign of cancer. Chronic pelvic pain is something that should be looked into by someone who is experiencing it for approximately 6 months. Pelvic pain can also mean something more sinister, like a tumor or ovarian cyst. Endometriosis is when the cells inside of the uterus grow outside on the ovaries, bladder, or rectum. This can cause various issues like pain during sex, painful bowel movements, pain during urination, low back pain, and infertility. Interstitial cystitis, a commonly misdiagnosed condition, is when someone has an inflamed bladder. Constant urination, discomfort during urination, and pain during sex are other symptoms that affect those with interstitial cystitis. Thanks for watching. Please tap the like button to support me, and also don't forget to subscribe me for more medical and health contents.